Good morning, everyone, on this very frigid Friday afternoon. I'm going to go straight into it because we have a lot to cover. For our non-Wisconsin friends, there's a lot happening at our state legislature, and that's the first part of our presentation. So do your email, talk amongst yourselves. Feel free to move along for the federal stuff, but there's a lot of action that folks in Wisconsin can take right now. And I know a lot of you have been itching for ideas of what to do. So we are in the final weeks of our state legislative sessions. Last week, I said that the Assembly had indicated it wanted to be done early, which is very typical for the second year of a biennial budget. Elected officials who are running again for election to keep their jobs want as much time to do that. So they tend to end their session early. And the Assembly said we want to be done by February. And we're planning on like 8 floor sessions. A floor session is when the full Assembly or the full Senate comes in and votes on bills that have generally moved through the committee process. And it's kind of one of the final steps that you need to take before a bill can be sent to the governor's office. It has to pass the full Senate and the full Assembly, and they have to agree on language, much like Congress. So the Assembly held 2 more floor sessions this week and lots of committee hearings. That means they've held 4 sessions now out of 8. The Senate had 1 floor session. And the next time they're coming back in for floor sessions is between February 10th and 19th. So you can kind of get a sense of, could they be done by the middle of February? Yes, possibly the Assembly could meet its own timeline. So that means there's a very little time to either introduce, get bills heard, get bills that have been heard in a public hearing, voted on by the committee, and get them to the floor if you're really trying to move everything through to be able to pass both the state Senate and state Assembly and get it to the governor's desk. So there's been a lot of activity. I'm going to pause and just note that there are 2 bills that are related to people with disabilities that had floor votes this week. They are bills that we kind of tangentially supported as an organization, like we registered on them when they had public hearings. And one of them is a bill that a constituent with a disability brought to a legislator's attention and, really asked for the legislature to act on. So, even though we are in a time where it feels like lots of things are happening that are not in our control, there are still examples of where, ordinary people doing kind of the normal rules of advocacy are managing to get small changes to happen. Do these things change a lot of the big things that we're worried about? No, but it is an example of there's always an opportunity to keep pushing and get some things accomplished. So the first bill is really a bill that makes the penalties the same for crimes that are committed against adults at risk, which is the statutory term that covers people with disabilities who are under, I believe, age 60. There's another statutory term called elders at risk, which is covering older adults over, I believe, age 60. And those 2 categories of people are considered separately in the statute. And the penalties for crimes against older adults are more significant than they are for adults at risk. So this is an example of a bill that's trying to recognize that older adults and people with disabilities have similar vulnerabilities and that we shouldn't make it less significant when people with adults at risk are taken advantage of versus older adults. And this is actually coming from some work that our board did a number of years ago through a federal Living Well project. This is one of the policies that we identified as being not the same. And the legislature in past sessions has done a lot to kind of increase the amount of penalties when a crime happens to elders at risk. And this is, saying, oh, maybe we should do that for adults at risk too. The second bill is a constituent-led bill. And again, it is trying to make the medical assistance purchase plan, which is the Medicaid work incentive program for people with disabilities, help people earn and save more. So the change that the bill proposes would allow more money to be deposited into what is called an independence account. The MAP program works where you do have to pay a premium on a sliding scale depending on your income. And how your income is counted matters, because that means, you pay a different amount for your premium. And it also lets you to set aside up to $15,000 in earnings in an independence account. So it allows people who are participating in this program to have more than the assets they would normally be allowed to in other Medicaid programs. This bill would also allow people with disabilities who receive a lump inheritance to be able to receive that inheritance without necessarily losing their eligibility to keep participating in MAP and Medicaid. And that is the particular issue this constituent brought to his legislator's attention, that he was set to inherit not a huge amount of money, but more money than Medicaid would allow him to have if he, wanted to stay in Medicaid. So the adults at risk bill actually already passed the Senate and the Assembly. So that's a bill that could go to the governor's desk to be signed. And if you're looking for things to do, you can always call the governor's office and say, hey, this sounds like a good idea, or I don't have concerns with this. You can feel comfortable signing it into law. And the second bill, independence accounts, passed the full assembly, which means all the Senate needs to do is agree, and that could also go to the governor's desk. The special education bills that we've been talking about the last couple of weeks have been introduced now, and they have formal bill numbers. These are the bills that would provide some sufficient funding to reimburse special education at the levels the current budget promised in July when it was signed. So it would mean that school districts would get 42 cents on the dollar this year and 45 cents on the dollar next year for the money that they've already spent on special education services. You might remember that this is an example where the legislature made an estimate of how much money was necessary to get to those reimbursement rates, and they were wrong. They used old data. So when the actual costs came in this fall, we were $140 million short to be able to cover the reimbursement rate that was promised. And districts were relying on that money when they built their budgets for the school year. So this is these bills are recognizing, hey, we promised one thing, but reality is another, and we should make school districts whole and actually, when reimburse the amount that we said we would for special education services. So here are some action steps now that we have those bills introduced. You can always click the bill number, and you saw it on the last slide, and that will take you to a page. And then you can look and see all of the legislators who are listed as co-sponsors on the bill. That means they've put their name on the bill, and it's usually seen as a sign of agreement. The more names there are, and the more names are on the bill from both parties, generally the better sign it is that the bill has wide support and is more likely to move forward. If you don't want to look up and read through all the names, you can also just call or email your legislator's office and say, hey, are you a co-sponsor on these bills? And if they are a co-sponsor, you can thank them and talk to them more about how special education has impacted you or your family. And if they aren't a co-sponsor, remember, legislators can add their names to a bill or take it off at any time. So it is perfectly appropriate for a constituent to ask, well, you're not a co-sponsor. Can you tell me why your name isn't on the bill? And you can give them some reasons why you think that this is a good idea. And you can also ask if they're willing to add their name as a co-sponsor. So that's one action on these bills. The other thing that you can do is ask the chairs of the Education Committee in both the Senate and the Assembly to hold a public hearing on these bills. The chairs of every legislative committee really do get to decide what bills that have been referred to their committee get a public hearing or not. And generally, bills need to have a public hearing in order to move any farther in the process. So, asking for a public hearing is really asking for the opportunity for legislators to talk about and hear from people about the bill, and then put them in a position where they might do the next step in the process, which as a committee decide to refer that bill on to for consideration for a floor vote. So this is an important step in the process, and there's two actions that you can do on special education right now. Last Friday, the Department of Workforce Development submitted what is known as a 1310. That stands for Wisconsin State Statute Section 13.10. Which is the authority that allows them to ask for additional money when what the legislature has budgeted has turned out not to be enough to run the program. And we have talked before that in December, the Division of Vocational Rehabilitation had to implement a wait list because it didn't have enough. The amount of money budgeted by the state legislature in the budget wasn't enough to provide the services that people were actually requesting and eligible for. So this request, and there is a link to it in the slide, is asking for an additional $11 million. And that would mean there wouldn't need to be any wait list through June 30th of 2027. DVR, like Medicaid, is a matching program. And what that means is the state has to put in a certain amount of money, and then the federal government gives them more money when they've met that match requirement. In the case of DVR, 80% of the funding comes from the federal government. And that means when the state contributes 20% of the costs, they get 80% more dollars to run the program. So it's a pretty good investment for states to invest a small portion of the total costs in order to get a lot more federal dollars for the whole program. You will notice a theme in the last few slides where there is a pattern of the legislature not setting aside enough money to meet the current costs of what we're doing now. We'll probably come back to that idea, but I think it's important for folks to remember as we discuss all of the places where what we thought was enough funding to do what we're doing now is not enough funding, especially as you start to hear maybe some comments about, oh, there's more revenue than we expected. And oftentimes you will hear policymakers talk about, well, if we got more money in, then maybe we can do a tax cut. Well, getting more money in is also how we fund current programs. And there are now several examples where the amount of money we set aside to do what we had promised to do has not been enough to do that. So what can you do on DVR? You can contact the members of the Joint Finance Committee. There are two co-chairs to the Joint Finance Committee, Senator Markline and Representative Bourne. And those two folks are responsible for figuring out what they're going to meet about and make decisions about. But there are also 14 other members of the Joint Finance Committee, and some of you may be represented by those senators and representatives who are the committee's task is to really make decisions related to money. So when we're talking about the state budget process, it is the Joint Finance Committee that really puts together the state budget plan that ultimately becomes what all representatives and senators are voting on. And so these are the folks that made the decisions about how to allocate state money that have resulted in the current shortfalls. And they're also the group of people who are going to be making decisions about whether to fill those gaps or not. You can also contact your state senator and state assembly representative with your thoughts about, what it means to wait for DVR and what you think the legislature should do. It's always helpful, even if your members are not on the Joint Finance Committee, to make sure that you are raising issues with them that are of concern to you and likely many other people in their districts. Sometimes those members not on the committee can have quiet conversations with committee members and say, hey, I am hearing about this a lot from folks. What are we going to do about it? And you can have a little bit of internal pressure that your members can put on joint finance. Another bill advanced out of committee this week. We haven't spent a lot of time on it, but it is a bill that is really of concern to older adults, especially, and also unpaid caregivers that may be in a medical situation, and really anybody over the age of 18 who is medically incapacitated. This bill would allow the hospital to pick from a list that is specified in the statute somebody to make medical decisions. And then that individual, called a patient's representative, would get pretty broad authority over the person and their money, to pay medical expenses. The hospitals have claimed that this is necessary because they want to move people who are in hospitals to nursing homes and other rehabilitation facilities faster. Many older adults and legal and disability advocates are very concerned because anytime there is somebody else who's being appointed to make decisions about another person, that's really a big deal. And there aren't any safeguards against appointing a person that, say, may not have that individual's best intent in their mind. So there's that piece, but there's also the other piece of, the reason why people are sometimes not able to move from a hospital to a different setting is often because there isn't any place to put them. And a national study released this week shows that staffing shortages in facilities are a main reason why there are people who are able to be discharged from hospitals that are ending up staying in the hospital rather than getting moved. It's important to know that study didn't also look at, what are the staffing shortages in the home and community-based settings contributing to people not being able to go directly to home, because there's certainly a lot to be said for transferring people and supporting unpaid caregivers so that people go directly to home in cases where that is possible. In cases where there isn't any support, that may mean that somebody is ending up in a rehab or skilled nursing facility instead of home because there isn't enough community staffing. So this bill is, you can see a link to the patient advocates put together kind of a long list of concerns and reasons why they do not feel this particular policy will really address the problem that the hospitals would like to address. And we also have seen an analysis of other states' similar laws. This bill is really, really out of keeping with any place else in the state. So action steps for this. Again, you can see whether your state senator or state representative is a co-sponsor on this bill, and the numbers are there. If they are a co-sponsor and you have concerns about the bill, you can let them know those, and you can ask them to remove their name from the bill as a co-sponsor and ask how they plan to vote on it if it were to come to the assembly floor. If they're not a co-sponsor, it's still important to let them know your concerns about the bill, and you can ask where, if the bill comes to the floor, whether they will vote no or not. In this case, you can also contact the governor's office and let them know your concerns about the bill. Oftentimes, especially when there are a lot of bills that are being, kind of passed in a very short time span, it's helpful to the governor's office to get flags from constituents and folks about which bills do people think are not a good idea or that are something that they would like to see the governor sign. We had another bill kind of sneak in and have a hearing this week. This is the time period when lots of things are introduced, and sometimes the time period between when they're introduced and when they have a hearing is very short. Sometimes it's only 24 hours. So all the advocates for older adults flagged this one for disability advocates. And it's, again, a bill that would allow caregivers to list up to 3 people that they're the primary caregiver for when they're renewing or applying for a state ID or a license. And if they have listed people, that would allow law enforcement to contact the emergency contact that they've also listed. So again, it's not a huge bill, but it's a great opportunity for many folks who are doing unpaid caregiving to make a contact with your legislators and let them know that, yeah, there are an awful lot of people that are really depending on unpaid care folks staying healthy and being able to do all of the many things that unpaid caregivers do every day, and what the risk is if the unpaid caregiver isn't able to continue doing those things suddenly. So it's a great opportunity to not only talk about this bill and its why it might be a good idea, but also a good time to, maybe elevate that Survival Coalition survey that showed how reliant people are on unpaid care and say, hey, this is me. And, there are consequences if we, keep relying too heavily on unpaid caregivers who are aging themselves. We have, oops, oh no, there. We have talked before about the ongoing need and the request that the Department of Health Services has made for additional funding for the food share program. This is in responses to HR 1, which was passed in July, that made changes to the SNAP program that will mean a lot more work for more people. Remember, SNAP already had prove you're working or exempt requirements, but the new federal law expands who is required to do those paperwork things to many more people than before. That means more work for the state. It also made changes that will reduce federal funding that is currently provided to Wisconsin to run the program, and impose, penalties for the state if there are too many mistakes that are made. So the legislature, or DHS, has asked the legislature since August for additional funding, and you can see, what they have specifically asked for. We are now at a point where some of the changes that the federal law imposed are already in effect. There was a wave of changes that went into effect October 1st in 2025 and more in December 2025. So the extra work and the extra requirements for people are already here, but we don't have extra people who are trained to actually do that extra work at this point. Also of note, in October, which feels like it's far away, but really isn't, that is when the federal funding to help run the program is significantly reduced. So if the legislature doesn't act in February or March on this particular request, it is likely that we will have at least another $32.5 million hole in our current state budget. And also no additional workers to do the extra work and help prevent mistakes, which could result in bigger financial penalties to the state. So at this point, the ask is, again, to contact your state senator and state assembly person and say how important it is for the legislature to use its remaining time to act on this particular request. Because there are consequences already that the state is incurring. There are people who need to do new things and likely more mistakes happening because there aren't enough workers to make sure all of those things are being done correctly. Plus a real, cut in the amount of money that the state is expecting or the state has to run the program. We talked a little bit about this last week. The Wisconsin Health News did a story yesterday about the new federal guidance that the questions that the Legislative Fiscal Bureau has raised and the uncertainty about whether CMS will let Wisconsin move forward on its plan to raise additional revenue for Medicaid. It's called provider taxes. And the federal reconciliation bill put some significant limits on what states could do, as well as made some other changes related to provider taxes. Our state budget passed 12 hours and was signed into law 12 hours before the federal bill. And I think the Hospitals Association is pretty confident that what was put in our state budget bill should meet the requirements by Congress. But technically, CMS has to give permission and sign off, and it doesn't look like they really want to do that automatically. So the Fiscal Bureau came up with what happens if you don't have permission to make these changes. And it could mean a $792 million shortfall, again, in our current state budget if Wisconsin is not allowed to do that. Now, we've also talked about how likely the state would have a strong case and would pursue a case to say, no, we don't. If CMS says, no, you can't do that the state would argue that it could. However, and if you've been paying attention in the last year, you will note that there are many, many court cases and lots of ongoing cases that are really deciding, whether or not the Trump administration was correct or incorrect on taking action many, many months after that action has been taken. So it is, even if the state is right, I think it is also true that the state would have to invest some time to having a case before a court that would agree, and convince them to agree that the state's position is the correct one. The reason this article is important is because this is not only the Fiscal Bureau memo, but this kind of article is something that legislators are seeing and they are paying attention to. And regardless of all of the things I just said about how right the state could be and the need, that they would have a very solid case, legislators are also moved by uncertainty in the sense that in the back of their minds, there's this unknown, fairly big ticket item that could happen. And what would they do about it? Sometimes when there are unknown things that can impact a budget, it may provide legislators with reasons or an excuse, depending on how you want to look at it, to not do other things that are perhaps necessary to shore up other funding gaps. And remember, we just talked about three of them with food share and special education and DVR. Those are also, items where there is a shortfall in the current budget. So adding on another piece of uncertainty may make legislators a little more reluctant to try and fill other real holes and use the uncertainty as a reason for not doing so. So it's important to press legislators to fill the gaps that they can, and also important to realize that a decision by the federal administration may mean a lot more work for the state in order to avoid another potential budget hole in the current biennial budget. I'm going to skip these three slides, but they are there for you to look at. Next week is our first Survival Coalition community organizing training. You still can sign up and register, I believe. Jeremy, if I am wrong on that, put it in the Q&A. But there are three separate trainings, and they are fairly long and intensive. But if this is something of interest to you, again, you still have an opportunity to sign up for it and get engaged. Moving to Congress. Okay, so we are now approaching kind of the latter half of January. And this weekend, the Senate released the legislative language for 4 appropriation bills, including a couple that are important to people with disabilities. So they released the Defense, Labor HHS Education Budget, Transportation HUD budget, and Homeland Security budget bills. These were the last 4 of the 12 appropriation bills that Congress needs to pass as part of its federal appropriation process. Notably, there were some healthcare policies that were inserted and attached into the normal Health and Human Services budget appropriation bill. That is a common strategy when legislators know that there's a bill that kind of has to pass by a certain time frame. They might try to add other things to kind of hitch a ride and get pulled through along with that bill. This week, the Senate was not in session, but the House was, and it passed those 4 remaining budget bills. There was some speculation late last week and early this week that perhaps the Department of Homeland Security budget bill might be, there might not be a lot of agreement. And there was even some people saying, hey, we should shut the government down based on the actions we're seeing from ICE. So in the House, they had a vote on the 3 budget bills, Defense, Labor, HHS, Education, and Transportation, and HUD as one. And they actually held a separate vote on the Department of Homeland Security budget. Both ended up passing, and the Department of Homeland Security budget passed with bipartisan votes. And it's important to remember the Department of Homeland Security, all of these agencies are fairly big and do a lot of things. So many members of Congress, while they might not like or support, what actions are being taken by ICE specifically, the Department of Homeland Security budget also funds things like FEMA and the TSA at airports and the Coast Guard and other things that that are unrelated to immigration, customs, and enforcement. So at least in the House, all of the 4 remaining budget bills have passed. Next week, the Senate comes back, and they will need to pass not only the 4 bills that the House just passed yesterday, but 2 more appropriation bills that the House previously passed. And if they do that, they will have passed all 12 appropriation bills before the deadline of January 30th, which would be a significant accomplishment. Congress has not done a great job of using the regular appropriations process in the last few decades. So this would be, yes, it's the regular process, but they haven't done it in a while. Also next week, the Senate had said that it will release its ACA subsidy bill. So we'll be watching for that. The storm that is now sweeping across the country may be a factor in whether members can get back to Washington. So, there are some things that really make the tight timeline, which was already tight, potentially tighter. It is not clear whether there is total agreement on the Senate side for the Department of Homeland Security bill. So it is still possible that not all of the 12 appropriation bills pass, in which case the Senate and the House would have to agree to extend a continuing resolution to keep those agencies that do not have a 2026 budget bill in place open and functioning. And remember, the House is out next week, so that would be a real challenge. Just a real summary of what I just said. 12 appropriation bills. We already have 3 signed into law. The House and Senate have passed 3 more, so we're up to 6. And the last 6 have at least passed the House and are waiting for the Senate to act. And the Senate has to do that next week. So what's in these budget bills? I have a link here for the full legislative text of the 4 budget bills that were released by the Senate. That is the Defense, Labor, HHS, Education, Transportation, HUD, and Homeland Security budgets, if you want to look through. These budget documents tend to be fairly dense, and they're not super clear. So we will expect that there will continue to be analysis of certain parts of the budget that perhaps, people with a big interest in, say, a part of that budget, say like public health, will put a lot of attention into. And sometimes it's hard to read these documents because you kind of need to know what was the funding level that Congress approved last year to know what was changed, whether it went up or down. But the big top line conclusions are that for the most part, Congress has pretty much rejected most of the funding cuts that were included in the president's 2025 proposal in May, and that most things received about the same amount of money as they did before. So this was a budget where kind of staying the course and continuing to do and fund things at about the same level as they were before, as a general rule, is true. Now, some of you might say, well, continuing to fund at the same level, that is technically a cut in the sense that if the cost of doing business is greater this year than it was last year, getting the same amount of money doesn't give you the same amount of purchasing power. But most watchers are relatively relieved that there are definitely not the cuts that were proposed by the administration that are being listed in Congress's intent to what they want funded and how much. Some things that we can highlight here: DD councils, which is what the Board for People with Developmental Disabilities are, they were level funded, itemized in the budget. Division of Vocational Rehabilitation, that actually gets an increase under Congress's proposal. And actually, the president proposed an increase in his budget for DVR as well. So when you're making your calls into your joint finance or legislative members, one thing that you can say is, hey, at the federal level, there's more support and more funding for this program. So when you're considering whether or not to increase state funding for DVR to eliminate the wait list, just remember you can draw more money down, and that this is something that's supported by the federal government. Some special education funding levels were increased, and the Administration of Community Living received a quite slight increase. So in addition to the full legislative text of bills, often the appropriations committees do summaries of what they are highlighting in the bill. And importantly, you might remember last spring, the Administration of Community Living was going to be eliminated. There was a lot of advocate pushback. So it's important to see that the Senate in its committee report specifically highlights the importance of the administration of community living, and that is where a lot of the programs that serve people with disabilities and older adults have been consolidated in the federal government. Um, the summary from the Association of Assisted Technology Act programs is actually pretty good if you want just kind of an overview of, many programs that impact people with disabilities. This is not a full list, but it does show you a nice little chart of here's what the program is and what is Congress proposing, what did the president propose, kind of that comparison chart. There have been um, some additional language that was included specifically in the labor, DHHS, and education budget bill that was related to health. And much of the content is actually language that was in a bill from December 2024 that the administration and Elon Musk specifically it was set to pass in December, and then Elon Musk and President Trump said, no, don't pass that in December of 2024. It does include some changes that are important, but these are not changes that really change the fundamentals of our healthcare system. So the changes that are in there are related to pharmacy benefit managers. There's some public health programs that are being renewed, community health center funding, which is important. Passing this budget will also renew telehealth, I believe. So there's things in that have been included and are kind of hitching a ride to the appropriations bill, but nothing that's going to undo like the significant Medicaid cuts that we saw in HR 1, nothing that is extending the ACA subsidies that expired January 1st. These are kind of old ideas that were agreed upon, a year ago that are kind of making their way into a bill where there is also agreement on funding the government and, to just get those things done as opposed to having to pass separate legislation. Education Week came out with an article that is really specifically focused on the education parts of the budget. So if you are a person that is really into special education and what the U.S. Department of Ed is doing, this might be an interesting article for you. And again, while Congress is rejecting a lot of the budgetary cuts, this article and some others are doing a good job of pointing out that the guardrails that many Democrats were asking for, like how do we make sure that what is passed as part of the appropriations bill actually happens? There isn't a lot of language that is specifically prohibiting some of the actions that we saw the administration make kind of do itself without asking Congress last year. So the committee report, again, worth reading, highlights some of the concerns they have about moving education programs to other federal agencies, but it's more notable that it doesn't tell the department it can't do that. And nothing in the bill language says, would stop pieces of the department where there's already a signed agreement at another federal agency from moving. There's nothing in the bills that seems to stop the Department of Ed from doing future agreements. And remember, there have been several articles, including some meetings with advocates and the Secretary of the Department of Education, where she has said there's an intent to move special education and civil rights enforcement and the rehab programs to other federal agencies. So it doesn't prevent that plan from moving forward. It also doesn't prevent, more reductions of staffing. Since last year, I think about 50% of the Department of Education federal workforce has been fired or retired or cut. There's some minimal language intended to at least try and say to the department, you have to tell us what you're doing. Um, and there is some language that says, hey, you know, the strategy of looking at two appropriation lines that are funding very different things and moving money from one into the other. We did see the administration do that several times last year. There is some language that would limit that kind of maneuvering. Um, and it also says, hey, you've got to give states their money on the date by a certain date. So those are the kind of some examples of guardrails, but they are perhaps not what as strong as what advocates or other members of Congress might have wanted, and they don't necessarily stop some of the things that we saw happen in federal agencies in 2025. This article also makes the same point. And as a reminder, there were many actions that the administration took last year, freezing funding, impounding funding, moving funding from one program to another, coming back to Congress and saying, we want you to take back money that was allocated, and firing and reorganizing agencies. So those are some of the things that happened in 2025 and in fact are still happening. We'll talk about a few things that are ongoing in a few minutes. And overall, Congress didn't include language to limit actions that the administration took last year that were actively, circumventing what Congress had said. So, it remains to be seen if the federal appropriations bills, assuming they all pass and assuming they are signed into law, will actually be implemented in the way that Congress intends. And it is unclear what Congress would do if that is not the case. So we've kind of updated our questions for Congress. Once you've made all of your state legislative actions and you've broken them apart to keep your weekends full, you can contact Congress too. And I think the question of what will Congress do if the budget that they have passed is not executed as they have intended is an important question, because now we know what they intend to fund, and we can also see that they haven't really added a ton of extra language to prevent some of the actions that the administration took in 2025. Moving to the ACA subsidies, so we still don't have language from the bipartisan group of senators who has been working on legislation that is supposed to be released next week, which again means they only have 5 business days, assuming everybody can get into town by Monday, to pass it, and 6 federal appropriation bills. It is technically possible to move that fast if there is a lot of agreement. I don't know if people believe that there is a lot of agreement. And certainly watchers earlier in the month did not take it as a positive sign that the language wasn't released. Usually when there's a delay in releasing legislative text, it's because there are members who don't agree on what it says, and they're taking more time to kind of write it so everybody who is negotiating on that bill agrees with what's written down before it's out in public. The other kind of clue is, we were hearing in December, and senators have said publicly that if the ACA subsidies aren't extended by the end of January, that's next week already, they're probably not going to be extended. So we are in the moment where it is possible that something happens, but it is also looking like it is a pretty high hurdle to go over. And again, what the Senate is proposing is not a clean extension. It is not what the House passed, and they are unlikely to take up and pass the extension that the House passed. So even if they are able to, get over the hurdle and pass some unknown legislative language that does something with the ACA subsidies next week, it is a different plan that would require more time for states, and consumers would have to understand their options, to be and to it would require more work for states and for people who are looking for plans, to be able to implement it. Um, there are, of course, more articles that are coming out about specific groups of folks that are, being impacted by the expiration of the subsidies. I pulled an article that's specific to farmers because that is, of real concern in this state and many others that have a lot of rural populations. There are also, kind of some different scenarios that papers are covering right now in terms of what has the end of these subsidies meant. And specifically for lower income people, of which there are many, rising costs of ACA premiums are pretty impactful. Specifically, there are lots of people, especially in states that did not expand Medicaid, which includes Wisconsin, who are really low income and are probably eligible for what are called $0 premium plans. These plans have been a part of the Affordable Care Act since it was passed in 2010, and they exist for a really specific reason, because there was recognition that, lots of low income people have a hard time paying even small amounts of money consistently, for healthcare. And it's unknown how many people who have an exchange plan don't have a zero premium plan, but it's likely to be quite a few, between 5 and 10 million people, depending on who you look at. And the reason why that's important, especially in states like Wisconsin, is that we have many more very low income people who are in the exchanges. Those folks who are earning between 100% and 138% of the poverty line in states that did not expand Medicaid to cover those people are getting their insurance, if they have it, through the exchanges. And for a lot of low income people, the reason why these, zero premium plans are important is because their income goes up and down. And a lot of them may or may not have access to bank accounts or credit cards, and that can make it really hard to set up a recurring payment. And of course, with healthcare, if you don't make your payment, you lose your healthcare. So the policy idea behind zero premium plans was to recognize that there are lots of people who have these challenges, low income, fluctuating income, and barriers to being able to routinely provide a payment. And that is a object of debate as, these different variations of, ACA extensions are being talked about. And there are certainly people who are advocating that there shouldn't be any zero premium plans, that they want a low minimum, amount for a premium, and other lawmakers who were around in 2010 who say, well, wait, there was a real reason we did that, and this is the reason why. So we had talked about the healthcare plan that, the president released last week. It really, is not going anywhere from Congress. Congress does not seem to be impressed. And it's notable that, it again does not address people facing higher ACA premiums because the subsidies have expired. It is not making huge changes to how the healthcare system fundamentally works. Lots of people are uncertain about what the plan would cost or save the federal government, which is often something that is considered kind of basic information about any bill. And lots of experts are saying, yeah, the ideas in here really look like they would cost people health insurance. So Congress is really not taking that up. However, there are a lot of people who are concerned about healthcare. And again, we've kind of refreshed these questions for you, but now that it looks more likely that Congress is not going to extend the ACA subsidies, and healthcare costs are going up for everyone, even if you have employer sponsored insurance or if you're on Medicaid or Medicare. Some of these questions are really kind of relevant to help lawmakers understand that, the little tinkers around the edges really may not be helping address the real problems that people have in terms of being able to afford healthcare at all, and also make sure that they get the healthcare that actually fits the situation they have and their healthcare needs. Um, we added also some questions in here because I think it is time to start reminding Congress that it's not only that you didn't extend the subsidies and that you made changes to the ACA, it's also that now states are starting to make cuts because of the reconciliation bill Congress passed. So it's time again to remind Congress that now you are starting to think about what are going to be the consequences of states cutting Medicaid programs, and that there are examples of states that are already making cuts because of HR 1 or will have to plan to do so in the next budget cycle. Specifically, we are worried about home and community-based services, which are optional under federal Medicaid law and on which many older adults and people with disabilities rely to stay out of institutional settings. So pull out all that stuff you did last spring. It's again relevant to remind Congress that you haven't gone away and that you still have the same questions, and that now you're starting to see receipts, that all of the things you were promised weren't happening are starting to happen in different places across the country. So Congress has kind of gone back and forth on whether they should do a second reconciliation bill. HR 1 was a reconciliation bill, and reconciliation is a kind of long word that basically means you need fewer votes in the Senate to be able to pass it. You can pass it with a simple majority of 51 as opposed to having 60 senators agree to the bill. And there are other features of a reconciliation bill. It generally has to be focused on budgetary items. It has to be able to conform to certain rules in the Senate. But it has been a way, a strategy that Congress has used in recent years to move forward really big pieces of legislation and only have votes from, say, the majority party needed to pass those changes. So what is interesting this week is that the White House budget director, Russell Vought, had a behind the scenes meeting and a lunch with members of the House of Representatives and is really advocating for a second reconciliation bill. There are House members that want to do a second reconciliation bill, and they have kind of released a plan. This is a screenshot of kind of the major sections of that plan. But what I think is relevant here is that the budget director really was interested in reconciliation as a way to change programs under the guise of targeting fraud, and was referencing various instances where there has been some public benefits fraud in other states. So I think that's notable for us because we heard a lot about fraud, waste, and abuse as a reason for cutting almost $1 trillion out of Medicaid during the last reconciliation bill. Like, it was pointed to as a reason. And we spent a lot of time talking about how there really doesn't seem to be a lot of fraud in Medicaid, that in what there is may be getting caught. But now the same rhetoric is coming back again, and it is being used as a reason to look for additional cuts, again, in social service programs. Maybe not only Medicaid, but certainly there are lots of people who rely on Medicaid that also rely on other social service programs. It's unclear if the Senate wants to do another reconciliation bill. And certainly because this is an election year, there are some members who really don't want to give potential voters another reason to perhaps vote for somebody else. So they see that cutting social service programs another time might, put them at risk for losing their job before the midterm election. It is notable that the intent is the same, though, that there is a group of folks who may truly believe that there is fraud, waste, and abuse, but also that fraud, waste, and abuse, even the idea of it, is a narrative that is sufficient to really demand pretty big cuts to programs that serve a lot of people. Moving to what the administration has been doing, we spent a lot of time talking about what Congress did not include in terms of kind of controls on what actions the Trump administration could or couldn't do with programs funded by the, what will be the new 2026 budget. It's important to note that the pattern that we have seen in 2025 is continuing. This is an example of, a new action, again, a memo from the Office of Management and Budget requesting all federal agencies to do a review of federal funding that is being sent to specific states. And in this case, it is 14 states that all happen to have democratically led governments. So again, the reasoning here is they want spending information on all federal money, looking for improper or fraudulent use of federal dollars. The states are listed here. All of those states happen to have voted for the candidate did not win the presidential election last cycle. And 13 of the 14 of them have Democratic governors. Wisconsin is not listed among these states that where this has been requested, but I think it is notable that the review of spending is being targeted to certain places and not other places. That is kind of unprecedented, and the scope of the memo is really fairly broad. So this would lean any federal money that's going to grants or loans or contracts or subcontracts or other awards to these places. And for most states, the federal government is actually one of the biggest parts of their state budget. Like revenue coming in from the federal government is at a lot of states, it's at least a third of the amount of money that is in their state budget. Medicaid alone is kind of the biggest part of most states' budget, and most states get more federal dollars contributed to that program than they put in for state dollars. So lots of the programs that people with disabilities use have some amount of money that is federal dollars that's being awarded to states. For example, special education formula dollars is an example. Any federal grants, transportation money, and that a lot of those are federal dollars. So it's a really broad set of spending that makes up a really big proportion of all states' budgets. Meanwhile, in the court system, a federal judge has blocked a federal agency from just cutting SNAP benefits. And in this case, it's Minnesota. So Minnesota has been in the news lately because there has been some fraud in a different program. And again, the judge is looking at the actions of the administration and saying, wait a minute, you know, you have changed how and stopped money going into the state and also put in new requirements that look like they would impact a lot of people and put in a penalty that if they don't do that, we're going to take away money for the entire program. And in fact, the federal agency said to the courts, well, we've already cut off funds to Minnesota, despite being in a court hearing that was determining whether or not they had legal authority to do the thing that they already did. So there are other states that, and Wisconsin is among them, that have also sued on this particular issue of does SDA have the ability to change the requirements of the program and then also demand data from states. You'll see a theme in data as we continue in this section, and have the ability to just stop funding if states don't do what they are asked by the federal government. And I think it's important to say that these actions that the federal agency has taken are being claimed to be in response to fraud, even though the agency has not provided any evidence that fraud has occurred in these states. It is really unusual for a federal agency to take such swift action against a state and actually use federal funding as a stick, so to speak, as a holding federal funding as a threat to states. And in this case, it does look like there's an effort to apply this to certain states and maybe not to others. Our friends at PHI, which is a national organization that advocates for the direct care workforce, put out an article this week. We have talked a couple of times about potential changes to a federal administrative rule called the public charge rule, and changes to that rule that would significantly limit, who could come into the country, especially if they had health conditions or disabilities. But there's another part of that rule that would look at anybody who is in the country, even if they are here legally, and put in some punitive measures if they used safety net programs like Medicaid and SNAP. They would, any legal immigrants' use of those kinds of programs might mean a different outcome or an immigration action that would maybe not allow them to stay here. So PHI put out this report because immigrants are about a third of the direct care workforce. And as all of us know, they are not paid well and they do not get benefits. So almost half of the direct care workforce relies on some form of public assistance. About in Wisconsin, I think about 25% of the direct care workforce is in Medicaid for their health care. Many folks rely on SNAP. Those are both public benefit programs under this new proposal. So it really does look like when you have a high proportion of immigrants in the workforce, and much of that workforce is on programs that potentially could put them at risk if the public charge rule goes through as proposed. PHI is saying, hey, this is a direct threat to the care workforce and could lead to even more workers either not getting benefits that they're legally entitled to, or driving them away from this particular workforce. Quietly this week, the FDA changed a website page. It's not this week, it was in December. They used to have a web page talking about different um, purported cures for autism that weren't really cures, that actually were treatments that were trying to be sold as cures, but actually not only didn't cure autism because there isn't a cure, but also could create pretty big harm for individuals. And I have on here what the page formally said. Um, and some of the things that were being promoted as cures. Um, this is a pretty big deal because there certainly are families that really would like to find a way for their, they're looking for options and looking for treatments. And that makes them very vulnerable to people who maybe are trying to take their money and offer them something that won't work, as well as people who might be trying to run an experiment that is unsanctioned or, submit people to treatments that could cause active harm. So it's a big deal that it was a big enough deal that enough of that was happening that the FDA had a public page on it. And now that page is gone. Um, when asked for comment, the Department of Health and Human Services said, "Oh, we retired the page." But autism experts were like, well, there was no reason to retire the page because all of the information that was on there is current. Like it's still relevant right now. Like we need to keep saying those things. And they also pointed out that there are lots of other examples where the FDA is continuing to warn consumers about various treatments or dangerous products for other conditions that are not autism, and none of those items have been taken down. We have talked about this before, but there is a more in-depth piece by State Line about how ICE is now using Medicaid data to find out where people are living. Wisconsin is among the 22 states that sued the Trump administration to block this information sharing. And in December, a judge ruled that they can share some of this information, but not others. But there are 28 other states that didn't sue, and the court didn't place any limits on ICE using Medicaid information to locate people in those states. The case is ongoing, which, again, tells you that the court system takes a long time and that some of these actions are now many months in the past that the administration has taken, and we're still deciding whether the action that they took and that they are using right now, it was legal or not. What has happened as a result of the data sharing and the lack of resolution, and frankly, it is unclear whether if the court ruled that the administration couldn't do this, what would happen if the administration continued to do it. What is happening is that there are many immigrants and mixed status families who are now growing more and more afraid of accessing any kind of health coverage because they have to weigh the risk of, will that create a record that someone I don't know might use for something entirely different? And certainly there are families where maybe there is a member who is an immigrant, legally here, not, and there may be young children or other members who are citizens. And, unfortunately, what people's experiences is showing is that, sometimes the record for one person leads to an entire group of people. So again, there's been kind of a theme here over the months, and now it's growing more clear, of the administration either asking states for more information or kind of sharing information that used to be separate between federal agencies for new and different and unknown purposes. And also not collecting certain information that they used to before that provided, measurements of, how much hunger there was in the country, how the economy is doing, and many other things. And along with that theme, This week, there have been several articles about, and again, this is coming out in court documents. There's an ongoing case that the actions taken by DOGE that happened last March of 2025, it is still unknown exactly what information was or wasn't shared. And in this case, the court documents were talking about Social Security records, where it looks like there was some agreement to share that data with certain states for the purposes of assessing, voter rolls. There are a couple of articles here, and I would point you to the third one because the Bulwark article, only because it does a really good job of saying, hey, this is a reoccurring theme, and this is the latest example of federal data being changed or used or combined with other federal data sets for other purposes without the knowledge of, the person the data is about or necessarily states. A different article went into more depth specifically about what the arrangement might have been about. So again, this is coming from court documents that the goal of getting the Social Security Administration data, which we don't know if it was provided or not at this point, was really trying to look at voter rolls in certain places with the outcome trying to be, would there be enough doubt that could change the results in an election? So moving on to continuing impacts of the reconciliation bill. I put this article in here because we've heard the term able-bodied kind of floated around a lot. And a lot of times people with disabilities have been told that won't apply to you because it's only going to apply to able-bodied people. But there really isn't, that term really doesn't have a medical, it's not a medical determination. And for a lot of folks, the idea of disability means, can I see your disability? And for a lot of people, their disability isn't necessarily visible. So when you hear the term able-bodied, it's really going back to some very old ideas that allow folks to think if you don't look disabled enough, then you should be working, right? You should be fully participating. And we often use the term as a way to screen people in or out are you eligible to be in a program, or do you have to do something, or do you not have to? Congress and the president promised HR 1 would protect the vulnerable. And I think we are starting to see that that is not going to be the reality. There's also some indications that, perhaps people who do have chronic conditions or disabilities might get caught in either not being exempt with whatever the Department of Health and Human Services decides should be exempt, or not able to prove that they meet an exemption. So I think that it's an important reminder that some of what we are hearing as either reasons why something will or won't affect you, or some type of test that says, well, we don't mean you, we mean some other people, is really going back to some very old ideas that are all about you should be doing something in order to, to get the Medicaid services or whatever services that we are providing. You need to be providing something yourself. It's much more of an exchange model that requires the individual to prove that they are not able to do things, as opposed to accepting that there are some people who may not look like they have disabilities that do have limitations on what they can do in order to get the services that they need. Pew Trust released a pretty comprehensive article on what is HR1 and specifically the Medicaid cuts going to mean for state budgets. They're a big research group that really does pay a lot of attention to fiscal health and what is happening in states in terms of revenue and budgets. And so now they have kind of put together what is going to happen to states when they have to impact or have to implement HR1. I think what's important for us to note here is that for most states, the costs of HR1 are going to hit in several waves. There's kind of the near-term administrative shortfalls. The reduction to federal funding for SNAP October 1st is an example of that, right? There was money that states were expecting before that bill passed to continue that, and that is not going to be the same. And then there are the costs of trying to figure out how to implement the prove you're working or exempt rules that need to be in place by next January. That's kind of the first wave of costs to implement the changes. And then there are longer term changes that hit in 2027, in 2028, and 2029 in the bill that we haven't talked about as much yet, that will continue to increase the fiscal impact for many states. However, this article is also saying that the choices lawmakers are making now are going to really matter in terms of what the continued financial impacts are going to be for years to come. So when you think about our state legislature, are they going to provide the funding for good SNAP implementation now? That matters, because that choice to do it or not is going to end up putting the state in a position where it will maybe have to make additional decisions about SNAP or other programs that are going to be kind of permanent and ongoing in future budgets. We talked a little bit about, states' revenue, right? How much money a state takes in from taxes and from fees and from other sources. States have been doing pretty okay for the last few years, but now we're starting to see that the amount of revenue that is coming in is slowing down, as at the same time there are increased costs that impact state budgets, like healthcare costs, like states pay for Medicaid and other things, and kind of some broader economic uncertainties, which happen on a cyclical basis. Some of you are old enough to remember previous recessions or times when all of a sudden there was a lot of unemployment, that the amount of money that taxpayers were paying from the year before goes down when their income goes down. There's lots of reasons why things that happen that are outside of states' control and unrelated to their budget or federal budget decisions can impact the amount of money that the states have to spend. The other thing that many states have done, including Wisconsin, is that when they've had some good times, they have cut taxes, which reduces the amount of revenue that states are taking in. That can be okay until you really need more revenue. And in times where, you have a tax base that's less able to pay, it is harder to implement new ways to raise revenue, either through sales tax or fees or income taxes. And kind of get additional money that you need when everybody is having a harder time. We've already talked about some of the cuts that some states are already making to Medicaid. What I think is relevant here is Medicaid looks different in every state. They have made different choices all the way through on who to cover and what services to offer, and what is the threshold for being able to get into services. We've talked about wait lists and all sorts of other things. But the current situation that states are in is going to really widen the divide between what states are doing when compared to each other. There are some states, and Wisconsin, I think, is one of them, that are worried about how do we make decisions to make sure that the most people continue to have healthcare coverage and that we are making decisions that aren't going to create more work for us. Other states are making opposite decisions where they look at some of these new requirements and maybe aren't as invested in doing a careful job because if people drop off the program, they feel like that saves them money because they're not in the program. So, the next couple of years, policy wise, are really going to be important to the long-term future of Medicaid in all states. And there will be states that have very different approaches to how to handle these cuts that may result in very different outcomes depending on where people live. Speaking of a state, another article from California, already California is trying to figure out what do we do with their version of Badger Care, essentially, Medi-Cal. That's a $200 billion program in that state. And what to do about the changes that are coming from HR1 is going to really be a focal point for their state budget. The current governor has not included money to kind of cover the gaps of what the cuts are that are coming. And that will mean that thousands of people are going to lose their Medicaid coverage because it's counted in the proposal that is an outcome that they expect. How many people? When we say thousands, over 500,000 people might lose their coverage in the near future. And that will continue to rise over time. And so this is an example where, California has a large Medicaid program. It has a large budget. It also has a large problem because the cuts that are coming from HR1 are large, and so are the costs. And this is yet another example of, a state that has been very, solid with its support for Medicaid is still ending up proposing ideas that would drastically reduce the number of people who would qualify for the program and saying, hey, we don't have the money to pay for people who lose coverage, and it's because of these federal laws. With that, I'm going to stop.
All right, I have a couple of questions. First of all, on the DVR funding, are there any legislators taking the lead on this? Have you talked to anybody in the Republican or Democratic caucuses or joint finance?
There are no legislators who I would consider are champions for DVR. Many legislators might not remember when we last had a wait list because we haven't had a wait list in 2014. And a lot of members are newer that they got elected after that. We have reached out to the Joint Finance co-chairs about this specific request. And I have not heard back from them yet. But it will be the co-chairs of Joint Finance who make a decision about whether or not this 1310 request gets a hearing and a vote by the Joint Finance Committee. And generally, they don't schedule a hearing for a 1310 request unless there is agreement to pass it. So the 16 members of Joint Finance really are the decision makers in this particular case because Joint Finance is the body that approves or denies or doesn't act on 1310 requests. There is no harm in contacting all members of the legislature as an educational event, right? Because so many of them might not be familiar with this program and the consequences of people waiting. But if your member isn't on Joint Finance, the ask is, hey, this is really important. There's been a 1310 submitted to Joint Finance. Will you ask Joint Finance and advocate for this to be, part of what they take up in February or March. That's a way that you could make that ask if your member isn't on finance.
All right.